We are live and
All right. Hello and welcome to the Diabetes Reversal webinar, where we talk about how to reverse type 2 diabetes using safe, highly effective, and natural remedies. I'm your host, Joe Barton with Barton Publishing, and we are blessed to be joined by Dr. Scott Saunders, MD. Now, Dr. Saunders graduated from UCLA Medical School, but he's now in private practice as a functional medicine doctor in Southern California. Dr. Saunders, thank you for joining us.
Oh, thank you for having me.
Yeah, so, speaking of functional medicine, could you just quickly talk about what's the difference between functional medicine and traditional medicine?
Yes, traditional medicine, we are taught in medical school to take symptoms and use drugs or surgery or other modalities to relieve symptoms. So where it's actually illegal to use the word cure, you can't use that word. The word is relief of symptoms. So if you look at the advertisements on television, advertisements, this is for the relief of symptoms of migraine headache or relief of symptoms of high blood pressure. That's the way it works. In functional medicine, instead of relieving symptoms with a drug or a pill or an herb or a vitamin, we look for the root cause of why something happens. And when you know why, then you can remove the cause, and then the symptoms are gone and you don't need any pills for relief of symptoms.
Yeah, that's awesome. That's a huge distinction to make. So we're looking into the root cause, and we're talking about diabetes, and so Barton Publishing has been helping people reverse diabetes, specifically type 2 diabetes, but we also help people with type 1 diabetes. And I think it would be good to talk about just real quickly, what is the difference between type 1 and type 2, and how many, are there more people that have type 1 or type 2?
That is really important because it's unfortunate that we use the same name for diabetes, type 1 and type 2, because they're really opposite illnesses. Type 1 is where the pancreas doesn't make enough insulin. Type 2 is where the pancreas makes too much insulin. Type 1 is when there's not enough energy getting into the cells. And there's a need to inject insulin. Type 2 is when there's too much energy getting into the cells and you need less insulin. So because they both have one thing in common, and that is the blood sugar goes up and then blood sugar spills into the urine, we use the same word, diabetes, for these two opposite illnesses. Type 1 is pretty consistent. It's about the same level through most populations. And that's when the pancreas stops working, stops making insulin. It used to be the main cause, the main type of diabetes back in the 1800s, early 1900s, there were very few people with type 2 diabetes. Now, however, type 2 diabetes is in epidemic proportions. We're going on 50% of the population that has either diabetes or pre-diabetes currently. In the year 2020, it's expected to be around half of all people in the United States. So by far, there are many more people with type 2 diabetes than type 1 diabetes.
Yeah. So, and that's, I wanted to talk about a little bit of the purpose of why we're doing this webinar. And, for us, we want to provide more value for customers that have purchased the Diabetes Solution Kit or the Diabetes Masterclass. But we also really want to get to know our customers more and to hear feedback, to hear questions, and figure out, like you talked about, we teach through a book, but like a cookbook, you might, have the recipe there, but you might not know how to cook. And so this is a way for us to share, from years of experience that you've helped patients, and then you can, kind of connect the dots for people that are maybe have questions or issues like that. But we want to provide a place for customers to come and anyone that wants to learn how to reverse type 2 diabetes using our plan. So
exactly.
Yeah. So just to give people a heads up of what the format of this call is, we're going to try to run for 30 to 40 minutes probably. And at the end of the call, we're going to open it up for people to raise their hand and ask questions. And we'll get into how you can do that using Zoom here. But what we like to do each week is to have a topic that Dr. Saunders will dig into a little bit further to further explain different parts of our program and answer frequently asked questions. And so today we are going to look into, let's see, sugar versus non-sugar diabetes. Now, is that basically, that's a term that's used in one of the videos that you did for us. Is that the difference between type 1 and type 2?
No, actually, that is very different. The word diabetes means urinating frequently. So frequent urination is diabetes. And in the old days, there were two different kinds. If somebody came to the doctor and said, gosh, I have to get up 5 times at night to urinate, and I can't go an hour working in the fields without having to pee. I'm just peeing all the time. The doctor would have to determine what kind of problem it was. And so there was the diabetes mellitus, and mellitus comes from the word miel, which is honey. And so the doctor would stick his finger in the urine and taste it and go, yeah, it's sweet. So you have diabetes mellitus. Or he would dip his finger in the urine and taste it and go, no, it's bland. So you would have diabetes insipidus. Diabetes insipidus is a kidney problem or a hormone problem where you're urinating frequently because of a hormone imbalance. It's a pituitary gland problem, and it has nothing to do with sugar. Whereas the other diabetes mellitus, is the sugar diabetes. And then under the sugar diabetes, there's the type 1 and type 2, which are both related to sugar.
Okay. Well, so speaking about sugar, let's dig down this rabbit hole a little bit. So tell us what is sugar's role in type 2 diabetes specifically, as far as does eating too much sugar cause diabetes, or is it more complex than that? What's the correlation? What is sugar to blame?
That's an excellent question, because that comes up all the time. And if you go on the internet and you look up, half of the people or half of the experts are going to say, no, it doesn't matter how much sugar you eat. The other half are going to say, wow, that's really important how much sugar you eat. And I think we should first define sugar. Sugar, we think of sugar as that white substance that that tastes sweet, that you put on top of your cereal or whatever, that makes it sweet. And yes, that is sugar, but that's only a relatively small portion of sugar. Carbohydrates like pastas, breads, cereals, rice, corn are all primarily made of sugar. And so all the starches, when we eat starch, it goes into our digestive system, and the starch is broken up into sugar molecules. So that's all sugar. So everything that is made of carbohydrate is made of sugar. So it's not just sweet. It's bland stuff too that has starch in it. So first, okay, that's sugar. So is sugar to blame? Well, here's what happens. In the cell, the cell requires sugar for energy. That's how we keep the cell going. That's how the cell does all of its functions, is it uses sugar. When you eat a lot of sugar, the insulin will bind to the cell and allow the sugar into the cell. The insulin is the key that opens the door and allows sugar into your cells. So you eat and you put extra sugar in the cells, and the cells store it in something called glycogen. And if you eat more, then they'll store a little more for a rainy day. And then sometime when you're not eating, like overnight, you haven't eaten all night or whatever, then the cell has this extra energy to be able to use to do its functions. If there's never any rest, if you're constantly storing, eventually the cell fills up with sugar and there's too much sugar in the cells. So it blocks off all the insulin receptors, so you can't get any more sugar in. It's like done. The door's not going to open because it's locked from the inside. So then the blood sugar starts going up, and that's where you have diabetes. Is there's too much sugar in your blood, and it's because the cells are overfilled with sugar. So with type 2 diabetes, you can say that yes, sugar is the cause, but it's all carbohydrates and all sweets and all sugars. It's not just that white sugar that we eat.
So I think that's a great point to make, because I think there's a lot of ways that sugar is added to our diet, like that's sneaky, that we don't realize. I mean, almost anything at the grocery store that's in a bottle or a can or a box is going to have added sugar in it. And it's also, the hard part is that it's called different names. Like you can have high fructose corn syrup or natural cane sugar, or I mean, all sorts of different names for it.
And a lot of things that people don't think about, like when you buy Cheerios, it's like, this is a whole grain food, but they don't realize that there's a large proportion of that whole grain food, it's made out of oats, is modified cornstarch or modified food starch. And that becomes pure sugar in your body. So it actually has a lot of sugar in it, where it doesn't even say sugar on the label, or only says 1 gram of sugar per serving.
So one, I guess, nice thing about buying foods at the grocery store in a box or a can is typically there's a nutrition label on it, and it's going to show you how many grams of carbohydrates in each serving. But you need to be careful about that as well, because oftentimes somebody could sit down and eat 4 servings worth at a time, and it's then it's all of a sudden, if it says it's only 5 or 10 grams, now it's 4 times that. So, and just maybe we can recap quick. Now, phase 1 in the diabetes reversal plan is to take your carbs down, your daily carb consumption down to 20 grams or a little less than that. You probably don't want to go too much. I mean, you could go way less, I suppose. It's not gonna kill you or anything, but 20 grams is kind of the maximum number of carbs in a day to really reset your body and to get it, working the way we want it to be working again, right?
Yes. Yeah. 20 grams is not enough to run your whole body for a whole day on sugar. So what's going to happen is all of those cells that have all this stored glycogen in them are going to start using that up, because you're not eating enough sugar to run your body. So then they're going to start using that stored stuff, and then they're going to open up the insulin. You're going to become more sensitive to insulin, and that reverses the whole process.
So insulin sensitivity is a good thing. That's what you want. That's normal function, is being sensitive. And it's type 2 diabetes is when you're what is it called? Desensitized or?
Insulin resistance.
Resistance, that's it. Yeah. So talking, that's good. And I was thinking too, so like you said, 20 grams isn't enough to fuel your body for a normal day. And then that's kind of where exercise comes in, or physical exertion, is the more, calories that you require to burn for, if you're exercising or if you're going on a walk, then that's more sugar that's being burned up in those cells as well, right? So that's why exercise is important.
That's part of why exercise is important. The using up, so there's 2 things that have to happen. One is you have to stop packing the sugar into the cells, and the other part is you have to actually use all of the sugar that's stored there in the first place. But that doesn't take very long. Actually, they don't store that much. They store maybe a day's supply or 2 days supply at the maximum. And so after that, they need to start using some other form of energy, which we all have fat on our bodies, and the fat then becomes the source of energy. Unless some people use protein, because protein is made into sugar. And if a person is not able to use fat because they're very insulin resistant, and insulin blocks us from using fat for energy, then they'll start using protein. If you exercise, your body will say, whoa, I need that protein. That's the muscle cells, right, are made of protein. So the body will start saying, oh, I need the protein. I'm going to have to start using fat, and we'll start using fat, and the insulin level will drop. So exercise has two big benefits. One, using up the excess sugar, and then two, preventing the use of our bodies, our structure, muscles, protein for energy.
Okay. So that's why, like Cedric, when he was in the hospital for 8 days, he lost so much muscle because he just wasn't moving, like he wasn't doing anything. And so his body then just basically starts using, because he wasn't eating as well. So it starts, yeah.
Exactly.
Alive by using the muscle, basically. Yeah. Yeah. So I have a biology question, and it's probably something I've just forgot over time. But like when I think of blood, I think of red blood cells, probably just because blood is red. But what is blood composed of? Because there's cells, but then there must be fluid outside of the cells that's in our veins and arteries, that is in our bloodstream. And that's where the sugar is in the blood, but not in the blood cells, right? So what is the difference? And is it only red blood cells that's in our blood, or is there white blood cells or other types of cells? How does that, give me a little biology lesson there.
Okay. Well, this is a little more involved. Blood is a very complex tissue. It has cells that are metabolizing using sugar, and cells that are not metabolizing. So you said red blood cells. Red blood cells are essentially sort of like dead cells. They're not metabolizing. They don't use a lot of energy. They're just sort of like packets of hemoglobin, iron, the hemoglobin to carry oxygen to the body. So they're sort of like passive carriers. There is activity, but they're mostly passive, just this little packet full of hemoglobin. So, and they just go along with the flow. They just go with the flow, and they carry their oxygen, and they let go of the oxygen where there's little out in the peripheral tissues. Also in the blood are the white blood cells, which is the immune system. And that is a lot of different types of cells that fight off bacterial infections and fungus and viruses, and they clean up all the cancer cells, they clean up all the other cells, the dead cells that are dying all over your body. And this is a constant battle. It's constantly going on all the time. Battle against foreign invaders, and then battle against your own internal, like cancers and cells that are dead that need to be cleaned up. So that's going on all the time. Also in blood is a plasma, and plasma has a lot of protein in it. And there's a lot of important things that happen from this protein, part of which is to bring things, to carry things to the cell. So there's fat. Some people have so much fat in their blood. I've drawn blood from somebody and let the blood sit, and the fat floats to the top, and had half of their blood was fat that floated to the top. And after a meal, sometimes you can see quite a lot of fat in the blood. Normally, there isn't nearly that much. You might have a little bit of fat float to the top. But some people have a lot. And then the proteins also carry other things. They carry other proteins. they carry hormones, they hold on to certain nutrients. We don't often think about it. We think, oh, we need iron, like iron's really important. But iron is really irritating to tissues. It's bad. It creates oxygen-free radicals, and it destroys DNA. You don't want iron floating around. So the blood has a protein called ferritin that grabs onto the iron and holds onto it so that it can't do any damage. And then the ferritin gets into the bone marrow, and the bone marrow says, oh, I need that iron, and the ferritin lets go of it, and so you can make red blood cells. So it's an amazingly interactive system that is beautifully engineered to allow us to function and not die from all of our waste products and chemicals.
So, what if you could guess, or if you know, what percentage of our blood is made up of, you know, red, white cells, plasma, and then I would assume some water as well?
Yeah. The red blood cells is about 50%, and a little less, around 50%. Then less than 10% is white blood cells, as far as the cellular part goes. About 70% of it is water, and then there's all the proteins and stuff that are soluble in the water, in the fluid system.
70% of your blood is water?
Yes.
But you said 50% is red blood cells, so part of that is also water?
Right, part of that is also water.
Okay.
Right.
And then the plasma is what, 30 to 40%?
Well, the plasma is mostly water, and then there's the white blood cells are in the less than 10% range.
Okay. All right, got it. Okay, well that's helpful, because as we study diabetes and we hear about insulin resistance, and you know, your blood sugar is too high, it's because the sugar isn't getting into the cells, or there's just too much. The cells are resisting, you know, the insulin, which resists the sugar because it's got too much sugar in there, basically. So just thinking about how this all makes sense, I think, is helpful to understand, so that we know, like, okay, why is eating 20 grams of carbs, why is that so important? And that really is the key. And, you know, so it just makes sense. Like, you're using energy that you've already added, is already inside of you, use that up. And then, you know, so let's talk about that a little bit. As, you know, as you gain weight, you know, your body is adding fat storage, or your fat cells are getting larger, I would guess, right? You're not necessarily adding fat cells, they're getting larger yeah. Yes. So what are fat cells? How does that work? And how, like, the sugar is converted to fat inside of the fat cells?
Oh yeah. It's an amazing process. We talked about the sugar being stored in your liver cells and muscle cells as glycogen. That's one storage of energy. And the other storage of energy is fat. And that's more for a long-term storage. And that's underneath the skin, in the abdomen, there are cells. And just like you said, we don't gain cells. We just make the cells that we have bigger. So that's one of the problems with people who say, well, I'm going to do like a tummy tuck or a liposuction and suck out some of the fat cells. They're sucking out the fat cells, but they can always eat more and make those the few that they have left bigger, and then they end up sort of in the same position.
Sure.
So,
yeah.
So it's not adding more cells, like you said. Yeah. So what happens then is, when there's insulin, the insulin tells the fat cell to bring the sugar in and convert it into fat. So then the fat is being stored, because fat is much more efficient. You can get 9 calories for every gram of fat, whereas from carbohydrate, from sugar, you only get 4 calories for every gram of fat. So you get more than twice as much energy per gram from fat than you do from carbohydrate. What's really interesting about that is there's been some research. There's a book called Endure, and it talks about long distance runners and how they can run such long distances. And they used to, in the 1970s, 80s, 90s, carbo load. People who ran marathon runs, for example, or triathletes, they would carbo load, and they would just load up on carbohydrates, sugar, starch. They would eat waffles and pancakes and smother them in syrup for breakfast, and then have huge pasta dishes so that they're just loading carbohydrates. Well, the problem with that, there's really only a limited amount that can be stored in your muscle cells and in your cells. The rest of it is stored as fat. And the carbohydrate is not as efficient as storage mechanism as fat is. So now what marathon runners have taken to do is doing essentially the Barton publishing program. They should read our book because they're training their bodies to use fat for energy by eating very low carbohydrate diets, ketogenic diets, so that it takes about 2 weeks, and they get trained to then use fat for energy, which is much more efficient. They can run an entire marathon on 1 pound of fat. Wow. Which it would take more than twice that much carbohydrate, and you can't store that much. So 1 little pound of fat, and they can run the entire marathon.
Yeah.
It turns out that they can't run fast on 1 pound of fat because it's not an efficient source of energy. So, but their bodies will use about 80% fat and 20% carbohydrates. Fascinating.
Yeah. Well, that's really helpful information. Thanks for explaining that. I didn't pay close enough attention in biology class, or maybe they just didn't teach us that stuff. But yeah, so I think now would be a good time to see if we have any attendees that have any questions or want to hop on and just say hello and share any experiences they've had or questions. So Kevin, you're kind of our host or tech person. Is there anybody here that we can that has raised their hand or has any questions?
Yeah, I see one raised hand. So let me allow, I believe it's Eric. And
hey, Eric.
Eric, did you have a question for Dr. Scott this morning? You should be able to speak now. I've unmuted you.
I do, yeah. Thank you for letting me come on. I was reading something on your website about cinnamon, and I think it was chromium, and the effect that would have on blood sugar levels. Can you tell me a little bit more about that? Just what that, how that can be beneficial?
Oh, yeah. Yeah, thanks for asking. Okay, I test hundreds of people, and in those hundreds, maybe even thousands of tests, I rarely see anybody who is not deficient in chromium. Chromium is a fairly common deficiency. It turns out that we don't have a lot of foods that contain much chromium. If it's not in the soil, then we're not going to get it. So we need chromium, and chromium is part of an enzyme that allows us to use sugar efficiently. In fact, in the 1990s, when they discovered this, there were chromium picolinate tablets that were fat reducers, and they call them weight loss drugs or weight loss supplements. And all it was chromium picolinate, because chromium would help them use sugar more efficiently, so they wouldn't store it as fat. They would be able to use their energy better. So chromium is really important. In fact, if people don't have enough chromium, they can get diabetes. There was one study on selenium that the people taking a selenium supplement every day increased the risk of getting diabetes. And everybody's like, what? Why does selenium cause diabetes? Well, because selenium and chromium compete for absorption, and you added extra selenium, and now you're borderline on chromium in the first place. So it kind of put people over the edge to where they would get diabetes just because they didn't have enough chromium. So that's the chromium part. The cinnamon part is much different. It is actually, in some ways, more effective than the drugs that make you more sensitive to insulin. So it's an insulin sensitizer. Remember we talked about the insulin unlocking the cell to allow sugar to get into the cell. The cinnamon makes that an easier process. The sugar flows into the cell more easily, so it allows the blood sugar to drop down lower.
That's helpful. Now, cinnamon, obviously, I know where to get that, and that's pretty easy. But the chromium, is that in certain foods, or is that a supplement that I should take? How do I go about getting the right amounts?
Okay, chromium is it's a good idea to supplement it. So we have a Barton Publishing. We've developed supplements specifically for this purpose called Cinechroma, and it has cinnamon and chromium in it, as well as vanadium and vitamin D, all of which make the cells more sensitive to insulin, because the insulin sensitivity is the important part for reversing the diabetes and preventing damage to kidneys and liver and the brain cells, and other nerve cells. So the way to get chromium is about 200 micrograms a day is an adequate amount. The form that it comes in, almost all of the forms, whether it's chromium picolinate is common, other forms of chromium, they're pretty well absorbed, and it's hard to get too much. You could do 400, you could do up to 1 milligram a day, and that would be okay. But it wouldn't be a good long-term solution, because kind of like with the selenium study, if you're adding too much chromium and you're taking it every day, then you're going to inhibit other minerals like selenium and vanadium, which are also really important for your body. So it's important not to overdo it.
And I'll real quick say, here's what Cinechroma looks like. And if you go to our website, bartonwebinar.com, we'll have links for the different products that we do offer as well, including Cinechroma and a few other supplements as well. So bartonwebinar.com.
So is that the major one that you recommend for controlling blood sugars, is the cinnamon and chromium supplement?
Yes, yeah. And the purpose of the supplement isn't so much to control blood sugar. It's to give the body what it needs so that you can heal from this, so that you can reverse it. Because if you're deficient in chromium, vanadium, vitamin D, then it's going to be much more difficult to reverse diabetes in the first place. So this is like a help. It doesn't fix the problem. All it does is help you to overcome the problem. And so really the book outlines the process of reversing the diabetes.
That makes sense. Thank you.
All right, and I think we might have another question here. Cheryl, did you have a question as well that you wanted to ask? I think there was something about saw something about low-fat cottage cheese, and I'm going to allow you to talk here.
Yes, I have a question. Is a low-fat cottage cheese good for you? And if your blood has so much fat in it, should we be eating low-fat foods?
Oh, that's a very good question. So with type 2 diabetes, remember, you have insulin around, and your cells, the muscle cells, the liver cells, are resistant to insulin, but the fat cells don't get resistant to insulin. So you're totally able to bring fat in. So low-fat cottage cheese would be fine. The less energy you bring into your body, the more you're able to use the energy that you already have stored. So the idea is to be able to use what you've stored over time. So yes, a low-fat cottage cheese would be fine.
What about all the healthy fat diets? Should we be concerned about eating more healthy fats than low fat? Should we do whole fat cottage cheese?
the amount of cottage cheese that you eat is more important than whether it has fat in it or not, because having the right kinds of fat is a good idea. So healthy fats have omega-3 in them, and the whole fat cottage cheese, if it's grass-fed dairy, then it's going to have more omega-3s than if it's from corn-fed dairy, for example. So having healthy fats is a great idea. And having cottage cheese is okay, but remember, cottage cheese is pure energy. Cottage cheese is protein and fat. And protein and fat are both energy for the body. And so that's fine if you have the fats in them and the protein, but eating less of it is a good idea.
Got it. Thank you.
So do we have any attendees, anyone on here, the call? Oh, Eric, that would be willing to come on and go on video and just share a little bit of your success stories in the past with the diabetes reversal program, and just share that with others. We like to have people go on video and just share their story, and it encourages other people, and it really helps us in our mission to help a lot of people to reverse type 2 diabetes. And so, Eric, I think it sounds like you were willing to do that.
Yeah, I'd be glad to come on.
All right. So Kevin, if you could
All
help.
right. Yeah, Eric, I'm going to promote you to a panelist. When I do, you should be able to share your video. Down at the bottom, it says start video. There you go.
Yeah, did that work?
I see him. All right.
Yeah, thank you. Yeah, I just wanted to thank you guys for what you do. I've spent a lot of time just in the last couple of weeks looking through the information that, in the diabetes manual, the digital version, as well as your printed book, and been through your masterclass series, the six section series of videos that Dr. Saunders put together as well. So lots of great information there. It's been very helpful for me and my wife and our family. We've got 5 kids, just in, learning how to look at food in a different way, to, consider, like Dr. Scott, you were just talking about with the cottage cheese example. I think, that this stuff is energy, and no matter how you look at it, we're bringing in more energy into our body. And sometimes we need to consider we already have plenty of energy in the body that needs to be used. So yeah, I think there's a wealth of information. There's still plenty more that it sounds like I need to learn. These webinars are going to be helpful for that. And I think that that Synachroma product I've had my eye on. I saw that in the diabetes manual, as well as have heard about it in other sources as well about cinnamon, and chromium and selenium and all this. So just tried to be a good student, but also trying to take action on what I am hearing rather than just absorb the information. So just wanted to thank you guys in person or digitally in person for what you're doing to help people overcome all the issues that we find ourselves facing.
Yeah, thanks for sharing that, Eric. That's great to hear. Looks like you're in a sunny spot there. Where are you at today?
Tallahassee, Florida.
Ah, very nice.
Sitting here with my daughter. You can say hi to Joe.
Hi, Joe.
Hey, how are you doing, Anna?
Good.
Good.
Anna will be a benefactor of all this information as well. She's my youngest.
All right. Hey, can you jump on your dad's back and like give him a noogie or something for me? Oh, come on. I know you can. Well, good to see you guys. Thanks for sharing. Thanks for hopping on video.
Yeah, thank you.
Yeah. All right. Well, hey, I think this has been a great call, and we're going to be doing this every week. And so everyone that's watching this, if you're watching a recorded version of this, hop on to bartonwebinar.com and we'll have a listing or a schedule of when our next webinar will be. We're planning on doing it every Tuesday mornings, but that may change. We'll see. But yeah, boy, Scott, this has been a great time, and thank you for sharing. Thank you for the biology lessons, and that's really helpful. And the more we know, the more we understand how our body works. And like you said, like it's an amazing. Our bodies are amazing, and our Creator is awesome. So I just, part of my mission personally is to help people go to the source and just appreciate how God made us and how He wants us to be eating and so that we can have, be living our best lives, the best version of ourselves. And yeah, so thank you for this time, and I really appreciate it. Any last parting thoughts, Scott?